Okay, so we will start in less than 1 minute. So welcome again at this live scanning session about the cardiac images scanning and the post-processing on our system. So now I leave the floor to the Jérémy Grosfroca, our customer manager for the MR customer manager at Buck for the architect system.
Thank you very much, Hicham. Welcome and good morning, everyone. My name is Jérémy Grosfroca. I'm the Customer Center Manager for GE Healthcare here in Europe. Today is Friday. It means that this is our last MR live scanning session for RSNA 2020. Last but not least, today we will cover a really exciting subject, cardiac imaging. So before to go further, let me just first introduce you Jérôme Bedet, who is our Zone Clinical Leader for Cardiac and Vascular Imaging. He will be with us during this whole presentation.
Good morning, everyone.
And we are also with Hicham Guajelia, a cardiac lover and the 3T Marketing Manager in Europe for GE Healthcare. He will be our moderator and he will follow all your questions in the chat box. So feel free to ask any question. We will dedicate time at the end of the session for a Q&A. So let's jump on our subject. So today it's cardiac imaging. So we will split the session in two parts. First part of scanning and the second part of post-processing. For the scanning, I just want to highlight and introduce you the coil we will use for the scanning session. It's the 30-element anterior array air coil. During the week of RSNA, we scanned a lot with this coil. But let me just come back on some important characteristics of these coils, specifically for cardiac imaging. This air coil is the breakthrough, the last coil technology from GE Healthcare. It's really light. It's less than 2 kilograms with cables and everything, which means that it will be really easier for the patient to support the examination. And when we think about patients which cannot support heavy weight on their abdomen and their chest, they would definitely prefer to be scanned with this coil. And also, the coil is really flexible. You can see that you can really fit the coil to your patient morphology. The coil will be adapted to any type of morphology. And also, it's not only about the comfort and about the flexibility. It's for sure about the image quality. The technology, the air technology embedded inside with 30 elements, which will give you the possibility to use high parallel imaging factor and to deliver you high level of image quality. This is what we will try to demonstrate today during this presentation. And I think we should not waste more time here in the room. I will install my patient. I'll let you taste that. And then we go at the operator console for the scanning session. So let me install the coil on my patient. So you can see, it's really like a blanket. I just put it on my patient and I just fit the coil to my patient morphology. And that's pretty all. So really easy to position, really comfortable for the patient for at the end have the best image quality. And we now just have to plug the coil. As we are in the magnet environment, I will have to take off my headset for a few seconds and then I come back.
So as you can see, we will connect the coil, and this coil is very flexible and it's very light, particularly when you have the ECG. For the patient that they have some surgery, the thorax surgery, it's very nice for the thorax surgery because it's not anything very weight on him. So it's crazy amazing as well for the coverage. You can see here, and I leave now Jérémy explain this in detail.
Exactly, Hicham. Thank you for this important precision. With the air coil, you have also a huge coverage. So here my volunteer is around 1 meter 90 centimeter, and you can see that we are covering thorax, abdomen, and pelvis. So you can really start to scan at some point and then move down your acquisition box without repositioning the coil, which is really convenient for your daily routine. Now let's create the landmark. to start the examination. I will use the IntelliTouch. Device here. You can find here on the side of the table. This is the sensitive strip band, and with only one finger, I will just have to press on it to create my landmark. Then I can send my patient in the board. So I see you in a minute at the operator console to start the scanning session.
See, have you seen right before? It's just really simple, just with a finger in the IntelliTouch, and you send the patient inside. So we are always always focus around our patient because it's the priority. That's why we are doing this. This job is to be focused always on our patient, and we can follow him until to go in the magnet. And now we will start in a few seconds the scanning session regarding the cardiac, and you will see the workflow and how we are providing the cardiac acquisition in our 3D signal architect with the Ericondl technology behind. So, and as you know, the cardiac is growing from each places. It is one of the big anatomy that today very few people are doing cardiac, but more and more often this exam it's asked because it's one of the latest exam we do to have the answer, particularly for the all ischemic heart disease and as well for the congenital heart disease. It's very, very useful, and you will see some techniques provided for the congenital heart disease as the 4D flow. So with the 4D flow, we can is the techniques that we have a 7D acquisition where we can have in the whole plane the flow. So now I leave the floor right now to Jeremy. So he will start the exam, and he can explain you before as well for the devices how it works. Jeremy, the floor is yours.
Thank you, Isham. Thank you. Thanks a lot. So we are here at the operator console. So first step before starting the examination, it's here. You have the capability to choose the SAR mode level. By default, we are scanning with the first level of SAR. But in case you have a patient with implants, you can choose the low SAR level, and then you will be able to fill all the numbers provided by the manufacturer of the implant to scan your patient in safety, and the system will adapt automatically the scan parameters to really fit and follow the requisition of the manufacturer. So let's start our examination with the first level of SAR. Let me start by, for sure, doing a 3-plane localizer and start the scanning. While the localizer is running, let me just demonstrate you a few things here at the operator console. First, here in the right bottom corner, you have the AirTouch interface. AirTouch is an automatic coils element selection, which provides you which will really smooth your workflow because there is no manual step. The system is doing everything by itself by selecting all the relevant coils elements. And also it will give you for sure more reproducibility and more consistency in your images. Another really important thing here is the protocol note. In the protocol note, you will have all the information in case you have a radiographer which is not really skilled and really used to work as in the heart examinations. You will have all the information regarding the planes, regarding the sequence, and you will be able to definitely improve his level by doing that. And here you have the waveform of the VCG. Let me just maybe redo the 3-plane. To obtain a better starting point. And here we talked about the waveform. Here you have all the needed waveform. You have the cardiac gating. You can pick the correct VTG line you want to use. You have also the respiratory and the peripheral gating display. And you can also adjust the fan and the light in the bar directly from the operator console. Okay. Let's start our acquisition by a Fiesta ungated acquisition. It will be a really short axial acquisition to have a strict axial plane that we will be able to use then to position our 4D flow at the end of the presentation. And just to show you what we will scan today during this live scanning session, we will try with the iDrive. iDrive, this is a real-time imaging, which gives me the possibility to create all my cardiac plans really easily, with the really easiest way, without asking any breath hold to my volunteer, which will be really convenient for the patient. And then we will scan a Fiesta short axis, and then a T2 double inversion recovery FATSAT sequence to demonstrate you Ericondl, and a T2 map for some quantitative imaging. And then we will finish with a 4D flow. And for sure, when everything will be planned, we will go with Jérôme for the post-processing part. You maybe heard the voice. So we have the auto voice. So the system is really managing everything regarding the breath hold command. So I don't have to take care of anything. So let's start this iDrive. I told you this is to position my plane. So you will see it's really easier. It's really easy it will be really easy to use, and it's also really useful in case you have abnormal anatomies or you have tricky planes to find. Okay, so just have to click on draw line, and with the right click, I have here just to obtain my 2 chamber. I can save images. Then let's create a 4-chamber, a pseudo 4-chamber. Okay. You can save. Short axis the same. I got my short axis. Just create the last one, 4-chamber. And that's okay. So you can see it could be really fast and without breath hold command. Let's position now the Fiesta Cine short axis. And for that, I will use the plane that we created during the iDrive. First, let me position the shim box. It's almost positioned. I don't have a lot to do to position the shim box. And then the same for the short axis for the acquisition box. Okay, as we don't have a lot of time, I propose to do only one slice, middle plane. Then we will move further to the post processing. While we are acquiring that, I open the T2 double inversion recovery FATSAT. You see, as we have this smart link here, we have exactly the same positioning and the same shim box than we have on the Fiesta short axis. So nothing to plan for me, as I plan correctly the first one. And here, as I said, we are using the Ericondl deep learning algorithm. So Ericondl, it's a deep learning based reconstruction algorithm, which is working specifically on raw data to depict and remove noise and Gibbs artifacts. So it will dramatically improve our SNR and improve our SNR, and then we will be able to scan with thinner slices and either high in plane resolution. You can look at it here at the operator console. You can choose your own level of Ericondl. Let me save this one. And the last one, T2 map, the same. I opened it, but it was not needed because everything was already planned. And you can see that this is for T2 map, so for quantitative imaging. And here in the operator console, you can see that you have an inline post-processing already planned, and which give me the T2 map at the end of the acquisition.
Maybe with that, we can take a look to the Cine Fiesta. So as you can see, it's a 3D system, but we have a very nice image quality, and we have a very nice temporal resolution and a very nice contrast on that image. You can see that it's a very, very high resolution with a very low slice thickness. It's only 6 mm, and we still have a very nice contrast on all the myocardium. Please take a look to the right ventricle and all this detail, which is very, very nice. And maybe we can also take a look to the sequence. During that time, I will run the T2 map. Of course, we have also the T1 map and the T2 star map for quantitative analysis. So here we have the black blood T2 image, and you can see all the detail inside this image. It's very, very amazing that you can achieve such detail on the left ventricle and also on the right ventricle. If you compare to the standard reconstruction, compared to that, you will see that you really increase the image quality. Here, take a look to this wall, which is very well defined with the Ericondl reconstruction, and also in this part of the ventricle, which is very, very, very nice. And you can zoom inside and view really the enhancement given by the Ericondl acquisition.
Thanks a lot for all that, Jérôme. So I think we can now position the 4D flow acquisition, and while it will running, we will start the post-processing. So it's a parasagittal acquisition. So you can see it's already pre-positioned on the system. So I just have to adjust following my patient. Just adjust the shim docs. Okay. So for the flow, we are using here we have a 2.1 acquisition in plane, 2 mm slice thickness for 4 minutes. So it's really a fast acquisition for this kind of technique. And this is because we are using HyperCat. HyperCat, it's a temporal acceleration technique, which gives us the possibility to achieve this scanning time. So let's run it, and then I can give you the ball, Jérôme.
What is also amazing with that sequence is that we have in we use retrospective gating. So we have the entire cardiac cycle. We can have also a very nice temporal resolution, and we can reconstruct a lot of phase during this cardiac cycle. So here we just reconstruct 30 cardiac phases during the cardiac heartbeat. So I will take also the end to show you the post-processing for the 4D flow. Please, we take this one. So here you can see the result of this acquisition exactly on the same system without GAD, without gadolinium injection on the Signal architect. So you can view the flow inside the aorta, but not only, you can view also the flow everywhere in the heart. So it's very nice, and now you can view everything inside the heart. So it's very, take a look. You can view all the information, all the flow, and this is a 4-minute acquisition without gadolinium. So you can have also flow measurement everywhere. So we have a measurement inside the aorta. We can also view different view, for example, with vectors. So with this kind of acquisition, you can measure the flow everywhere in the heart, in the aorta, in the pulmonary artery, on the left side of the pulmonary artery, and so on. So it's very, very convenient and very, very quick. Another good thing with that circle post-processing is that you have artificial intelligence to make all the processing of your heart. For example, I will post-process all the heart with only one click. I click on this button, and all the artificial intelligence will process all the heart. We make the contour for everything, and you will have directly the ejection fraction and so on the heart. You don't have to click a lot of things to have your post-processing done. And it's not only for the left and right ventricle, it's also for the atria. So with only one click, you can post-process everything. You have all the function and of the left ventricle and also of the atria. So it's right there. You can have all the volume for your atrial, left atrial and right atrial. It's very, very efficient. And what is also very very useful is that you can add everything in a great report. I will put both, and with that you can have everything inside the report, your measurement, the normal value, and also you can have you can give information about the cardiac other acquisition like late announcement and also perfusion. So it's very nice, and of course you can export, save your protocol to your PACS or to your hard drive. It's very convenient and very nice. Maybe you can go back to the acquisition part.
Isham, do you have question in the chat box? As I see it's only 5 minutes remaining.
Yeah, I have some questions and I reply it in live. So feel free to ask questions again.
Okay. maybe we can just highlight also the T2 map we generate from the T2 acquisition, and we are finishing the 4D flow at the same moment. So you have the post processing is automatic for T2 map. So you just have to create region of interest if you want to get the value of the myocardium. Maybe Jérôme, if you have some comments on that.
Yeah, just one comment about the 4D flow. You can see that you already have directly after the acquisition, you have a very nice view of the acquisition, and it's a very fast reconstruction. Just to give you a quick result. For the T2 map, what is very amazing is that we have a very homogeneous signal in all the earth, and we can put, of course, a region of interest inside that map to get the value inside the earth. Of course, we have the same thing for T1 map and also T2 star. Also, you can see that the image reconstruction for the 4D flow is very fast. You can see here the number of slices of images reconstruct per second. So you can see this number is very varied.
So this is, yes, to demonstrate how powerful could be the reconstructor to really deal easily with this amount of images. Can have a look at the image. Maybe Jérôme can let you comment those images also.
As you can see, the resolution is very nice. We have a very nice contrast everywhere. Here you can see the flow inside this very small vessel. It's amazing. We can also, of course, reconstruct everything in all the plane. So I can turn a little bit with that. I can view the flow everywhere in all directions, which is very nice. And we are totally retrospective, so we have the entire cycle. So it's very nice for that.
Thanks a lot, Jérôme. It was crystal clear for me. I hope for everyone. Isham, do you have comments or things to add? We have a few minutes.
Yeah, I have some questions, and I can reply directly in live. And as well, Jérôme, if you can have a look on it, you can reply if you want, as you're an expert. The first questions, another questions I got, it's can you say about the range of the echo time in the T2 mapping advanced part of the acquisition? So just for information, so we have the cutoff for the value of the T2 mapping. If there is edema or not edema, it's 56 milliseconds. Above this value, we can say that there is an edema. Below this value, we said that it's normal. But of course, if you follow the SCMR recommendation, you will have to perform the normal range on the normal population on your system between 15 patients until 50 patients. This is the recommendation. So the value that you have to acquire with our T2 mapping is to have at least one value above this 56 milliseconds. So we have two value before and two value after to have the better fitting. And I got another question from Daniel. Can we use Ericondl for the 3D technique for the wall heart? So Daniel, we cannot use for the moment the Ericondl for the 3D technique for the wall heart. It's compatible with most all of our sequences today. And as you know, we just launched it, and we are developing these techniques to be compatible with all our sequences because it's really amazing, as you saw previously on those examples. So yes, today it's not compatible, but soon. Yeah, I saw that Vaid have a questions, so feel free to ask, Vaid. You can open your mic if you want, or put the questions in the chat. Vaid Chame, you can open your mic if you want to ask the questions. Okay, there is another questions. Hypersense is compatible with the cardiac sequences. What do you mean by hypersense, and in which sequences do you need hypersense? So today, to accelerate due to the temporal phases, we use hypercat as we used on the 4D flow sequences, and the hypersense today it's for our 3D sequences, and yeah, it will be a part of the development for the 3D techniques. And today, as you know, with the software release, it's compatible with a lot of new sequences like Cube, MRCP, and time of flight from the first release. And today we expand this to the other sequences for the gradient echo, like Lava, Disco. There is as well the Amperage, the Bravo, and most of the gradient echo. I hope it answered to your questions. For the Fiesta, do you recommend Pure or Scenic, and why? Oh, okay, it's a good question. Maybe, Jérôme, would you like to take these questions, or I can take it as you want?
Yeah. Which questions? Sorry, I didn't
For the Fiesta Cine, do you recommend to use Pure versus Scenic, and why?
I use both Scenic and Pure. They give a very nice homogeneity correction, so I use both of them. Both of them are great. I like Pure because the reconstruction is very quick and very fast, but both of them are nice.
Okay, so maybe we can take on only one more questions if you have questions. Okay, great. So I think we answer at the most of the questions, and we are straight on time. So thank you all for joining. Thank you to Jeremy for this great demonstration, and Jérôme as well, and the power of AI that we have today for the acquisition, for the image quality, and as well for the post-processing. So you will find the recording soon that we will share this recording with you very soon. Thank you very much. Yeah.
Thanks a lot, everyone. Have a nice day.
Have a nice day as well, and take care, and an excellent weekend. Bye.